Hello, my name is Anna Schost, and I'm a student in Lindsay Nesmo's Structure and Function of the Human Body course, and I chose schizophrenia as my disease for the course project. And I will begin. Without a doubt, the pathology of schizophrenia is an interesting disease, both in how it affects people and why it affects people. It is a disease that affects the way a person behaves, thinks, and sees the world. Right. Looking at the etiology of it, there are many opinions to be found. Some believe that for the most part there is no known cause for schizophrenia. It just happens or it is inherited through genes. Others believe that some stress involving environmental factors may have something to do with it triggering the disease, such as an early loss of parent or low oxygen levels at birth. As for what cells, tissues, and organs are affected by this pathology, the brain is a pretty obvious one. There have been studies made on the brains of normal patients and the brains of schizophrenic patients, and there's a significant loss of brain tissue in those affected by the disease. Abnormalities in the brain structure may also play a role in schizophrenia. Enlarged brain ventricles are also seen in some schizophrenics, indicating a deficit in the volume of brain tissue. There is also evidence of abnormally low activity in the frontal lobe, the area of the brain responsible for planning, reasoning, and decision-making. Some studies also suggest that abnormalities in the temporal lobes, hippocampus, and amygdala are connected to schizophrenia's positive symptoms. But despite the evidence of brain abnormalities, it is highly unlikely that schizophrenia is the result of any one problem or any one region of the brain. Andresen, Napolis, Magnotta, Pearson, and Zeebel said, "Our own program, the Iowa Longitudinal Study, is the largest study of this type and has the most frequent MRI assessments and the longest duration. We recently reported that ILS patients have greater tissue loss over time than healthy comparison subjects, which we refer to as progressive brain change, and that such change has functional significance and that is related to severity of psychotic symptoms and cognitive impairments." There is also effect on brain cells by disrupting the way in which brain cells communicate with each other. The neurotransmitters that carry signals from one brain cell to another might be abnormal. Malfunction in one of the transmitters, dopamine, seems to be a source of the problem. This is likely because the major medicines that are successful in the treatment of schizophrenia limit the production or carrying power of dopamine. Another likely suspect is serotonin, a transmitter whose presence or absence has important influences on behavior. Sometimes schizophrenia comes without warning, but it is more common that it comes on gradually. Families of the individual notice little things that are different or odd about their loved one that they just can't quite explain. Dropping grades, disinterest in old favorite hobbies or activities, isolation, and eccentricity are a few early signs of schizophrenia. Some more physical early signs can be as follows: a blank, expressionless stare, hostility, bad hygiene, depression, insomnia, odd statements, amongst others. There are 5 types of symptoms characteristic of schizophrenia: delusions, hallucinations, disorganized speech, disorganized behavior, and the so-called negative symptoms. However, the signs and symptoms of schizophrenia vary dramatically from one person to another person, both in pattern and severity. Not every person with schizophrenia will have all symptoms, and the symptoms of schizophrenia may also change over time. Melinda Smith and Jeanne Segal. The possible preventions for schizophrenia may seem like an impossible, and schizophrenia may seem like an impossible force unable to be stopped. There are, however, possible prevention theories popping up in the medical field. One of the preventions is lowering any stress in the household that may be triggering the disease. Problem solving and stress reduction are the main focuses of some programs out there that are designed to target and prevent schizophrenia. Sometimes drugs are prescribed, such as Abilify, which can stem hallucinations. Those should be used cautiously and only at low doses. Sometimes simply just having a caring adult to listen can help those who feel helpless in their early stages of schizophrenia. Another interesting method that I found extremely interesting is genetic selective breeding. This is done through the process of artificial insemination. After an egg is fertilized in the laboratory, scientists remove a cell from the embryo and examine it for specific genes that are implicated in a specific disease. And any embryos affected by the schizophrenia genes just simply wouldn't be chosen. This is a tantalizing yet ethically compromising method worth considering. Treatments for schizophrenia are many and varied, but the first is antipsychotic medication. Some examples of them would be Abilify, Safras, Clozaril, and the list goes on. Among those would be therapy, family therapy, social skills training, and employment mentoring. And schizophrenia requires lifelong medication, and many people are reluctant to use the medication due to their side effects. The short-term consequences of schizophrenia is being frightened and stressed due to hallucinations and sensations they cannot control, while long-term effects of schizophrenia are isolation and relationship problems. They realize that the symptoms make other people and their loved ones feel uncomfortable, so they may separate themselves from the awkwardness. In conclusion, whether it's a person suffering from early onset schizophrenia or they have struggled with the debilitating effects of the disease for a long time, schizophrenia is not curable, but it is treatable. Many people with schizophrenia can lead rewarding and meaningful lives in their communities. Hopefully, those communities can lend a listening ear and open their arms to these people who may be a little different, but need love and relationships just like you and I.